Ladies and gentlemen, welcome to the inside of my car. Oh yeah, driving home from some night shifts. I want to talk about this one case in particular that is stuck with me. It's making me think. I think all of us in medicine really want to help people. We live for those moments. It's really great to save a life. It's satisfying to work with someone and help them manage their blood pressure and their diabetes so they don't have all these problems in the future and they don't die of heart attacks and strokes. And it's also great to help people work on their lifestyle so they don't even have these problems in the first place. It's really hard when you can't help somebody with any of that. I had a young 40-something-year-old homeless man who came into the ER because he had an infection on his skin. He had terrible diabetes. He already had lost both of his legs. He had both of his legs cut off from infections from diabetes. So it's already severe. And so I can help his infection a little bit. I can drain the abscess and make that a little better. I can give him antibiotics to treat the infection under his skin. It's going to come back again. His blood sugar was almost 500. Normal blood sugar is like 100, less than 150. His was 500. He was on insulin. Insulin is a liquid. You have to refrigerate insulin. He's homeless. He doesn't have a refrigerator. It's so basic, you know. You've kind of got these basic needs, underlying needs, and if those aren't met, it's gonna be really hard to take care of yourself and your health. 42. I mean, this guy's not gonna live to 50. No way. No way. And so I'm like. And he's a homeless guy, so I don't know what is his life like? Does anybody, engage with this man in a human way? And so in the time that he has with us in the ER, I just want to be human with him and just be like, hey, how's it going? Where are you from? And how'd you end up here? He's hooked on meth. He's addicted to methamphetamine. He relapsed a month or two ago, and he's been on the street since, and it's just, addiction's hard enough when somebody has resources and money and support and family, and when you don't have all that stuff, I'm just stuck thinking about this case and feeling for this guy. What can I do for him? What can I really do for him? Yeah, in the moment I can be kind and I can treat his infection. We can get that to go away. I can bring his blood sugar down from 400 for a little bit. I give him a shot while he's in the ER. We're so incredibly limited. It's hard. That part is hard. I mean, for those of us who are in this business and this profession to help people and to really make a difference and keep people alive, and this is such a basic level of survival. This guy's just at the survival level. He can't even think about higher level things like happiness and fulfillment and self-realization and giving to others. These are higher level orders. You got to take care of yourself first, and this guy's just thinking about the next meal or the next bridge he's gonna sleep under. It's really hard. It's really difficult as a doctor and a provider to help people in that circumstance. That stays with me. I think about that a lot, and this is not the only guy like this that I've ever seen. Homelessness and addiction and It's reality, man. You know, walks through the door in the ER every day, and he's just one of like, I don't know, probably had 5 or 6 homeless folks last night alone that have similar challenges to taking care of themselves. Getting to the pharmacy to actually get the medication, you know, these basic, keeping the medication on them, taking it every day, things that you know, these pills that can be life-saving. It's overwhelming. I think a lot about all of this stuff. This guy doesn't have a mission. You know, he's just at this level of survival. Like, I want to, you know, what can we do? What systems should be in place? Because I can't. One encounter in the ER, like, I can do my best. I can try to get through to this guy, but you got to get off those drugs, you know, one step at a time, kind of take some meds, and find something in life you're living for, some kind of joy, not a drug, you know, not the high, but somehow connected to people and making a difference and helping and or just enjoying time. But I think about that. How to get through to that guy and what to do. Let me know if you have any ideas. That's what's sticking with me today, especially as the holidays roll around, and you know, I think about a lot of these guys on the street, and it's where I'm at. It's heavy. That's what I'm thinking about. Okay, I'm done. Thanks for listening. Give me your comments. Subscribe to my YouTube channel and all that stuff. See you next time.